Hi, my name is Deirdre Chance, and this is my final project for Counseling 5317 entitled Counseling Individuals Living in Poverty. The importance of counseling individuals living in poverty to multicultural counseling includes many of the following factors. According to Su et al., multicultural counseling is defined as a counselor's acquisition of the awareness, knowledge, skills, and the cultural humility needed to function effectively in a pluralistic, democratic society. Multicultural therapy, or MCT, is a helping process which incorporates therapeutic goals along with the client's individual experiences and their universal cultural dimensions. It'll include things like the client's race, culture, ethnicity, gender, sexual identity. Culturally competent counselors should not only seek to be skillful in the context of cultural concerns such as race and gender, but also in the context of poverty and classism. Classism is an oppression on the order of otherism, such as sexism and racism, where a dominant group has the cultural power to obscure the needs of a minority group, which results in continued discrimination and prejudice. Living in poverty often places individuals in a place of discrimination and where they lack sociocultural power, and that limits their resources for well-being and help. Research demonstrates a link between mental health and poverty. Poverty increases one's chance of mental health symptoms. The biological causes for mental health disorders due to poverty can be explained by both cognitive, affective, and behavioral factors. So, for example, for cognitive and affective behaviors, stressful living conditions can actually increase cortisol, which correlates to many mental health symptoms. Cognitive factors such as future discounting, where impoverished conditions lead us to discount like the increased future long-term rewards. And then along with that, we can have reduced executive functioning, which often results in pursuing shorter term rewards rather than being able to put off the gratification and the rewards for greater long-term rewards. And attached to this as well, a cognitive factor is just believing that there's an external locus of control, and that correlates to a learned helplessness. And then as far as a behavioral factor is that you end up pursuing the least risky, which correlates to pursuing short-term gratification versus greater rewards with long-term waiting and endurance. So those are some of the ways, again, that poverty gets into us neurologically, physically, biologically. The next point, poverty and mental health interventions, which include combining asset help with mental health interventions, are the most efficacious. So an example is cash transfers combined with mental health interventions such as family, group, or individual psychoeducation, community rehab program, and medication. Another essential element of counseling for individuals living in poverty is that the counseling must overcome the practical problems of seeking treatment, such as transportation limitation, unusual and inflexible work schedules, a lack of health insurance. Competent counselors should also commit to growing in knowledge and awareness of poverty, social class, and related privilege or discrimination, and the everyday signs of social class bias. Competent counselors include a social justice framework into which case conceptualization and treatment and a flexible approach to treatment are all combined. Competent counseling, finally, should also include problem solving, resource identification, but at the same time address other issues of concern to the client based on their socioeconomic lived experience context. Overall, I agree with Sue, Neville, and Smith's Counseling the Culturally Diverse. First, I agree and found it beneficial how the authors note that poverty is not a cultural designation, and those living in poverty are often unseen by psychologists in both clinical practice and research. So even though it doesn't fall into a specific cultural designation, that kind of lends even more contributes to how poverty can be unseen by psychologists, not only in clinical practices, but also in the research. I also agree with the author's view that individuals living in poverty are often one accident, one setback from a catastrophe. Generally, poverty derives from the overlap of socio-political and historical factors rather than individual choices. I appreciate how the authors expose the many inequalities and disparities that exist between an individual living in middle class or higher society and individuals living in poverty. Some of those disparities are social, educational, judicial, employment and wages, healthcare. Counselors of middle class background need awareness of possible biases related to these disparities. And finally, I agree and appreciate how the authors urge and state even more critical for mental health professionals to learn about sociocultural biases, attitudes, assumptions, and procedures that are often embedded in worldviews of people who hold social class privilege, and the ways that these assumptions are manifested within both practice and research. In conclusion, although poverty does not classify as a cultural designation, if we are a counselor from a middle class or higher background, we likely do not see the sociocultural power we have in society that grants us access to many services and resources which individuals living in poverty lack. Appreciating the resiliency of individuals living in poverty, plus the disparities which exist for individuals living in poverty, is an important part of multicultural therapy. Incorporating the above information into our case conceptualization and treatment is necessary, as well as learning from community members on useful adaptations. Finally, as culturally competent counselors, we should be practical in counseling efforts with the incorporation of problem solving and advocacy for resources. However, we also need to see the individual needs of the client and approach their concerns from their lived experience context. And here are my resources.